All right, if you could tell us about the current projects of Apollo.
No, from a technology standpoint, current projects are split into categories related to operational excellence, clinical excellence, service excellence. So it's not really a technology driven initiative, but it is an outcome driven initiative that adds value to healthcare. So we've been working to grow our PHR. We are on a digital course in terms of proliferating our digital electronic medical record. We are into mHealth. We're doing some early work on IoT. So and analytics is definitely a part of all of this, combined to give the efficiencies that we are looking for in our overall health system.
All right. Where do you see yourselves? Where does Apollo see themselves in the year 2028, when we would be the most populous country in the world?
Well, our mission is to touch 1 billion lives. So in a way, probably will be geared for that. We would like to see ourselves as a completely interconnected environment where we deal with every aspect of health delivery. When we talk of every aspect of health delivery, we are talking about the entire cycle from illness to wellness, and in wellness, keeping the patient well. So that means that being in a position to stay connected with the patient, keeping them well, and in the event that they need medical intervention, we're able to get to it fast so that the speed to diagnosis is as quick as possible, and thereby great clinical outcomes. And as much as possible ensure that the spread of preventive medicine is strong, so that it touches 1 billion lives, thereby ensuring that the entire ecosystem is keeping healthy and is sustainably keeping healthy. And whatever we could do in our bit to reduce the spread of the non-communicable diseases, and spread of non-communicable diseases sometimes is by changing behavioral patterns, changing social lifestyle patterns, educating it, sometimes catching it early and keeping it controlled. So all of those we see as how we can do, obviously trying to ensure that we use the right mix of technology such that we can get this going. Also in terms of ensuring that the right levels of medical education is spread, because clearly there's a huge demand and supply gap. And when there is a demand and supply gap, you need to ensure that it is bridged with the right combination of technology so that it acts as an enabler and helps the healthcare providers as they deal with the various healthcare emergencies, healthcare needs, and the growing demands of the patients, and keeping it well balanced.
Right. What has been the reach of Apollo in the rural areas, and if there is any corporate social responsibility in healthcare?
Definitely. A couple of ways you can look at it. One, corporate social responsibility. We're running an initiative called Total Health, where in a town close to Chennai, it's called Aragonda, which also is the birthplace of our founder chairman, Dr. Pratap Reddy. We've literally helped transform the entire township, not just with healthcare but also with all round social and economic development around the area. So that's something that we're doing as in addition to it, we run our program called Sachi, which is Save a Child's Heart initiative, ensuring that underprivileged children who need heart surgeries are taken care of economically, and not just economically, but ensuring that that treatment is meeting the expected outcome and they are able to lead healthy, normal lives. So that's kind of, and one of another big initiatives that we are doing is the Billion Hearts Beating, where we are trying to educate large sections of the society on cardiovascular diseases, staying away from smoking, exercising, making sure that our diet is healthy, well balanced. So education around that is something that we do as corporate social responsibility. Also, we have partnered with the government's Common Services Center, CSCs, wherein our telemedicine booths are part of the government's common service centers, thereby ensuring that we have reach of healthcare even in remote areas of the country, such that they are able to connect to tertiary hospitals in the event that they need tertiary care, and if they need a second opinion on some diagnosis and they need to alter a course of treatment if it's not working out right for them. So all those are also part of our initiatives. Not everything may be corporate social responsibility, but heavy focus on ensuring that healthcare is accessible, affordable and available to all. So that's kind of what we're doing.
Yes, I was just about to ask you this question. So how do you take care of this biggest challenge of affordability and accessibility?
Well, the moment we think of affordability, automatically it comes to everybody's mind that it is free, and I don't think that's the right way of looking at it. Yes, things do have a certain cost. That cost has to be kept rational so that the entire ecosystem is sustainable. Even for not-for-profit organizations, there is a cost involved, because only then it can go back into their system. So the notion of free has to be really wiped out. Keeping sure that there is a balance between affordability and access, and probably sometimes the two can be taken together and sometimes they may have to be looked at in different. One, when you look at access to healthcare, that's where comes the reach of mHealth, the reach of eHealth, telehealth services overall, where we make sure that those services are available through various medium of technology, and they have access to the right levels of healthcare. Sometimes it could be something simple advice on healthcare to something complicated like an intensive care where we run electronic ICUs. So our ICUs in Hyderabad are connected to hospitals in Nasik, Nellore, where you may not be having the highest quality of intensivists in those towns, but at the same time there is a need for it. So the right use of technology. So that's about access. Access is also about making sure the right levels of information is available so that there is not misinformation on healthcare. So that's where mHealth and eHealth play a picture. Telehealth, so that you are able to ensure that one level of doctor-patient relationship or even doctor-doctor communication, provider-provider communication happens. You may need advice from or deliberations with colleagues who need to be in different parts. So we have our grand rounds. We have our tumor boards where doctors are able to consult using sophisticated video conferencing, where they are able to look at clinical information also in context. It's not just a visual, but in context clinical information. So that's kind of looking at extending the access to it. Talking about affordability, ensuring that we have high levels of operational excellence, completely eliminating the waste in the process. So that means a combination of Lean, Six Sigma, effective operations that keeps cost controlled, remove the waste, increase the efficiency, and thereby ensure that we don't compromise on quality, safety and clinical outcomes. So that's where you look at the right mix of technology with the right mix of process education, with the right interventions of operational efficiency that keep costs contained or keep costs within affordable reach or keep costs rational. So that's kind of, and sometimes a combination of access and affordability ensures that, but nothing at the cost of quality, safety and clinical outcomes. That is something that cannot be compromised at any point in time. So that's kind of what we do trying to ensure that all of this is kept within reach and kept available to everybody who needs it.
That's really nice. Well, we have the foreign direct investment in the healthcare sector. Do you think it has benefited the sector?
Well, definitely investment into healthcare is good. As I said, as long as it is kept within the balance and ensuring that the right healthcare is available to the nation, and also that foreign direct investment helps with boosting the overall economy of the country and increasing the quality of health services that's available to our own citizens, I think it's the right thing to do. I think it's good. Again, not compromising on the importance of healthcare to its citizens and its importance to the economy as such, and not just the direct healthcare economy but also the affiliated industries that benefit out of the healthcare economy. So I think it's a win-win all round as long as we keep it well balanced.
This sector is one of the best sectors in the current scenario. A few do's and don'ts for startup entrepreneurs who plan to come to the sector.
First don't, I would say, is there is no instant gratification. I know there are wonderful success stories that we've heard and we're very happy for the success stories, but not everything can be instant gratification. You have to understand the healthcare ecosystem and the healthcare workflow. Solutions have to be tailored to the workflow. Just because a solution works in the West does not mean it works in this, and similarly just because it works in India. So good attention has to be paid to workflow. People have to spend time, understand the solution. At the same time, that doesn't mean that people can just come into a healthcare organization, learn, because no healthcare organization can afford that type of a learning curve and time spent with somebody. So it's a balance. One side I'm talking about people have to learn, and one side I'm talking about efficiency. So you've got to make sure that you have the right balance. So people have to think a little bit and look at solutions that are operationally sustainable. Most important part is not just that we have a solution, can it be sustained? Can it be sustained for 6 months, 2 years, 5 years? Is it support friendly? Is there a benefit to the target customer, be it the hospital, the doctors, the nurses, or the patients, whoever is the customer there? Is there a benefit there? Is it simple and straightforward so that it can be done with minimal training? Because the more and more we complicate technology, the more and more we complicate solutions, people will shy away from it. So I would say, as much as the technology behind may be complicated, keeping it simple is what will get startups benefit from the industry, and the industry to benefit from them, because the industry needs a lot of innovation and there's a lot of scope, but there has to be focus. There has to be focus on staying sustainability and keeping the cost rational. I would love to say low, rational is probably the better way to put it.